Welcome to Tea Time with Karen. Today I'm going to talk about urinary tract infections. This is pretty common, at least for women, and men do get them as well. And the usual signs are like a pain, like right in the back or back. Sometimes I may feel like it's right above the hip bone, but it's something that's quite serious and really should, ask a doctor to look at it and make sure you don't need anything stronger than botanicals to help it. A lot of people use cranberry juice for the UTIs, but I find D-mannose is better. D-mannose the E. coli, which is usually the cause of the UTI, will attach to the D-mannose, and then the bacteria will be urinated out of the system. So it's really a good way to handle it. Drinking a lot of water is really important. That will help flush any of the bacteria out of the system. There are other cranberry juice, like I said, is something used. And then some people will use uva ursi. And uva ursi for short term is not too bad, but for long term it really is not a herb to be used. It has a lot of tannins in it, which will interfere with iron absorption. It increases potassium excretion in the body, so with certain medications it shouldn't be taken, like lithium and digoxin, or two of them. The other thing is that uva ursi needs an alkaline environment, and I've seen combinations of supplements that have uva ursi and cranberry is very acidic. So that is going to interfere with the uva ursi, and you won't be able to utilize it because it needs that alkaline environment to be useful. So you want to make sure that if you are going to use uva ursi, that you're not drinking cranberry. And if you do decide to use cranberry, at least 2 to 3 hours separated so they don't interfere and you get the benefits. But like I said, uva ursi is really not safe to use long term, and it has been shown for long term use to affect the gastric mucosa and be irritating to it. So I think the best options for UTI: drink plenty of water and use D-mannose. If you want, if you get UTIs often, then maybe prevention with some cranberry juice beforehand. Thing is, with commercial cranberry juices contain a lot of sugar, and sugar feeds the bacteria, so you really want to make sure it's pure cranberry juice unless you get it in a pill form, and that can be very tart. So anyway, those are some tips for UTIs, and really a chronic UTI, you should see the doctor and probably need antibiotics to address. That's it for Tea Time, Karen, and I'll see you tomorrow.